this is Dr. Humaira Badsha, consultant rheumatologist, board member, and founder of the Middle East Arthritis Foundation. It gives me great pleasure to invite you to World Arthritis Week from the 10th to 15th of October. It's a completely online event. Come and learn from expert rheumatologists, physiotherapists, yoga specialists, and nutritionists about your arthritis.
Hi, I'm Sandria. On behalf of the Middle East Arthritis Foundation, I would like to invite you to register to the World Arthritis Week, which happens from the 10th of October. A lot of doctor-patient discussions, professional speaking on mental and emotional well-being, yoga and Pilates and dance happening. So please go all out, register yourselves, friends and caregivers, and enjoy yourselves.
مرحبا، أنا عبير. أنا كتير متحمسة وأنا عم بستنى الإصدار الجديد من أسبوع مرض التهاب المفاصل العالمي اللي حيكون أونلاين حيبدأ ب10 أكتوبر. جلسات ممتعة ومعلومات قيمة ومفيدة بانتظاركم، لهيك لا تنسوا تسجلوا حالكم وتسجلوا عائلاتكم وأصحابكم. بنشوفكم بجلسات الأونلاين، ديروا بالكم على حالكم.
Hi, I'm Dr. Humaira Badsha. I'm a consultant rheumatologist with 30 years of experience in rheumatology across 3 countries, the United States, UAE, and Singapore. The most common question patients ask us is about diet and how they can exercise and take charge of their arthritis. Hence, I've taken all these years of experience and evidence-based medicine, as well as consulted experts in the field. And we have this book for you, The Wellness Guide to Arthritis. Proceeds from this book go to the Middle East Arthritis Foundation. So I do hope you will read and find this book useful.
Good evening, ladies and gentlemen. I'm Ghita Harifi. I'm a rheumatologist based in Dubai since 2012. And I'm very pleased to be here today, taking part in this World Arthritis Week program. I would like to start by thanking the MIAF, the Middle East Arthritis Foundation, for the tremendous and amazing work that has been going for months to bring out this World Arthritis Week program. The agenda for today will be speaking about medication. So we need to know about medication for arthritis for the first half an hour. Then we'll move to talk about psoriatic arthritis for the second half an hour. And at last, we'll be talking about lupus. So the last half an hour will be dedicated to lupus. Without further ado, we'll start the first session where we'll be talking mainly about medication and treatments for arthritis. And for that, we have the pleasure to have with us today 2 of our eminent colleagues in rheumatology, Dr. Atheer Ansari.
Good evening.
And Dr. Kirthi. So Dr. Atheer is our colleague from Dr. Atheer is our colleague from Abu Dhabi. He is a senior consultant rheumatologist from Mediclinic Airport Road Hospital, Abu Dhabi. He's been in the country since 2013. He's originally from Iraq. He graduated and he, is educated in the UK, and he has held, a couple of important positions within the Emirate Society of Rheumatology. Dr. Kirthi. Hi, Dr. Kirthi. Good evening. So Dr. Kirthi is a consultant rheumatologist who graduated from the prestigious Madras clinic in India. And she's based in Dubai, where she works in Atheer Medical Center, Medicare Orthopedic and Spine Hospital, so in Dubai. Dr. Kirthi has a couple of, has a long experience in across various institutions in India, Oman, and UAE. So I would start with the first question with Dr. Atheer. Dr. Atheer, what are the main medications and treatments that we have now to face arthritis, to treat arthritis?
Many thanks, Dr. Ghita. This is a fundamental question to all patients listening to us today. Most rheumatologists now, they follow some international protocols, and the protocols about medication divide them into three main categories. I'm talking primarily about rheumatoid arthritis, but other type of arthritis fitting in a similar protocol. The medication are three categories. The first one is, we call it anti-inflammatories or painkillers. These are usually for mild disease or localized disease. They can help enough without need any sort of concern about them, only if they are really taken in a long-term way. And many people have their disease controlled with this level of medication, but they don't suppress their inflammation. The most important people with arthritis, with high inflammation and swelling of the joints, they need more potent medication. And there are, again, two levels. One, we call them the conventional therapy, the like of methotrexate, sulfasalazine, araba. Many people would recall these names. And these are suppressing the inflammation and then improvement of the joint status, improvement the pain, no joint damage, better quality of life, everything. However, these medications have limited efficacy, let me say. They don't help everyone to that great deal of what we call inflammation suppression. In recent years, and in the last 15 years or so, we have a lot of advances in the field of therapeutics, and a lot of new therapies all comes under the name of biologic therapies. We have plenty of them. They come either injections or infusions or even tablets, and they help the inflammation of arthritis to a better efficacy or potency and better response to the patient. And they have transformed the shape of arthritis in the body. We stop seeing that deformities of the joints and erosions and quality of life much better. The problem with these medications are a bit expensive, but we are lucky in this country that we have insurance system allow us to at least prescribe one of these items one way or another, and to help the majority of our patients.
Great.
Patients listening today need to understand the importance of taking these medications to help themselves rather than, let me say, ignore or delay them, because they will pay the price for that. I think that's a quick summary, because I think we are short of time. Allow Dr. Rita to move on.
Thank you, Dr. Atheer. So so we're here today to talk about medication and about the need for continue taking medications even when we think that we're doing good. So this is actually, this takes me to the second question, Dr. Kirthi. What does make our patients stop medication and discontinue medication? Because this is one of the issues we're facing in the clinic. So Dr. Kirthi.
Hi, thanks, Dr. Ghita. And Welcome all on this event on the treatment of rheumatic diseases, one of the biggest challenges we have. Unlike other conditions like diabetes or a high blood pressure, everybody has understood it, everybody has accepted it, and it's so easy to tell the diagnosis. They are ready to go forward. They are coming, get set, go. But when it comes to arthritis, the challenge begins with the diagnosis. It begins, why did I have it? Is it going to be lifelong? Will I be crippled? And then you start about the treatment. Next thing is it lifelong? And will I become all right? Is it for a few months? And then comes the adverse effects. So there are multiple challenges. Introducing the medications, then discussing about the side effects, then the duration when you have to go on them. Multiple challenges. So when you begin with the medications, as you all know, one of the core medications which we prescribe are the DMARDs, or the disease-modifying anti-rheumatic drugs. And the way the healthcare system works is that by the time they reach the seeker, the one who's going through the arthritis, by the time they reach the rheumatologist, they have already gone through the phase of early symptomatic treatment, which includes steroids and the NSAIDs. Next comes about starting the DMARDs. So we begin about the DMARDs, and as you all know, the cornerstone is methotrexate. And most of those who are with rheumatoid, Shabnam, all of them know about methotrexate because they have taken it. So the biggest challenge is about opening up about methotrexate. There comes the history of methotrexate, the background of it. And I remember Dr. Ghita's talk in 2017 or 2018 about methotrexate, the dose and all of that. So introducing is a big challenge. Like methotrexate has a tag with it that it's a medicine used for chemotherapy. So again, you have to put it in simple terms, like the sugar you use in coffee or tea in a very small quantity, like half a spoon or a spoon, while your sweets, they are literally loaded in sugar. So the proportion is like that, and it's a very small dose used for its role as an anti-inflammatory medication rather than a chemotherapeutic medication. So first is understanding the medication and introducing it. So most of them are welcome, and some of them who are well read and well informed, they would have done their research and then they come with it, and it's easy to go ahead with them. But there are some people, some of them who have who are yet to come out of the shock of the diagnosis of an arthritis, and they have not gone ahead with it. And so then that group is the biggest challenge for us. So then you talk about it, and then about the side effects. And the challenge about side effects is when you talk about the side effect, it's as if they are going to get all the negative of the medication rather than the positive thing. Wow. So again, you have to explain that, that it's primarily intended for a benefit. The side effects which you talk about it's a very small percentage. And the reason for talking about side effects is to stop it then and there. So if you are aware of it, we can prevent any damage. So we can minimize it. It's all for your good. And it's to help you out and improve the disease and make sure that you are not, you would not end in the damage due to the disease. So this is about the side effects. So it's there is another group who will who just accept the diagnosis and they are ready to follow the instructions. Then it becomes easy, and they are the ones who follow meticulously. So this is about introducing medications. We begin with one, sometimes we need another one and the third one, then switching to the biologics. These are the newer medications. So we have multiple challenges. Another important challenge is about the duration of medication. Many a times people mistake it to be a short course treatment, like a month, and then they would stop there. They would say that we didn't know that it's for long term. We just thought it's for a short while, and then we took it and we stopped. We were fine. And then now see it's come back and it's not. So one of the most important challenges in the treatment of arthritis is heading towards specific medications, which is DMARDs, having a good rapport with your rheumatologist, know the medications, know about it so that it works for your good. It doesn't lead to any harm, if at all, the chances of which are the least. And be in regular touch with your rheumatologist and follow the advice. We are all to help you. We want the treatment to do the best. So many times we say that the treatment helps you. So at times you might feel it, but it may not be visible. So it may continue to be an abstract thing without being visible. But if you don't go with your treatment, then it damages and it's apparent and it's seen to a third person. So the main role of treatment is to make you feel like a normal person and be as a normal person without any damage. So it's all for your benefit.
Correct. And you summarize actually the whole approach of the patients when we start a treatment for a chronic disease and for a disease like arthritis. What about here and now the patient's perspective? And let me start with Ms. Shabnam. I would like to hear from you, what was your experience with the medication that was prescribed to you, and how was the acceptance of the DMARD that was offered to you? Shabnam, please.
Like I was suffering with arthritis like for the past 18 years, and it is like a roller coaster. But by the support of all my doctors and my family, I was able to take all the medicine. I always looked into a positive attitude, and I continued the medicine as it was prescribed by the doctors. The medicine really worked because it helps to control the arthritis and the pain. So I was feeling much better with that.
So this helped you to accept the medication and to...
Yeah, at present, like when I got this medicine, when I got arthritis, I was very depressed and sad. And I used to always think, why me? Why did it come to me when my family members have no arthritis history? But I took it in a positive way because I took it as a challenge. I know that I have to fight and survive in order to mentally control this disease. So I accepted the medicine and I continued the medicine as prescribed by my rheumatologist.
Excellent, Anna. Let me ask you, Danielle, what was your experience with the treatment, and have you suffered from any side effects? Were they significant enough to let you, think about discontinuing, or at least talking to your rheumatologist? And Danielle?
Yeah, hi. So I'm Daniel, and I was diagnosed with juvenile rheumatoid arthritis at about 15 years old. I'm now 23 years old. And when I got diagnosed initially, we started with the basic medication, which was, the anti-inflammatory and all of those. And eventually we moved on to the methotrexate and then even biologics. So for me, I also feel that the medication helped, but it kind of had its lifespan, you can say. Some of the side effects, mainly for me, I experienced was clotting. There was a medication, and that it affected the way my wounds, if I got hurt anytime, it would affect the way my clotting, and I straight away told my rheumatologist, and we stopped the medication so that it wouldn't go any further, and we changed medication, and it seemed to be better.
Okay, so what was this medication, if I may ask? Just to clarify this point.
I can't recall the name, but it was one that, it was just a tablet that I had taken, and this one was, I think it was after the DMARDs, and this had just, I only noticed it later eventually, and I told my rheumatologist, Dr. Amal, about it, and she said it's the side effects of the medication, which I had read, and it was just like, again, it's a rare thing for the side effects, but you weigh it against the benefits of the medication, and I could see that taking the medication did help me. I'm a very athletic person and I like to do sports. And when I started, I was not able to get into sports. But during the course of my medication, listening to the rheumatologist and the support team around me, I did find that the medication taken on time, taken as prescribed, even if it still hurts, as prescribed, it helps. And, you find most relief in the long run. And of course, initially you see some, you can see some benefits in the medication, that it's instant, and some of the medication does take time to work. Right. So eventually I found that from being not really active in sports to being able to play all of the sports that I used to play before through medication. But this was only through continuity and, a schedule of keeping on taking them at the right time, taking what's prescribed and things like that.
Correct. Yeah. Thank you. Thank you. So let me move to Ms. Vijaylaxmi. How can I?
Hi, good evening.
So tell us about your journey with your treatments, and what was the, how easy was it for you to be on a treatment that is meant to be life, for a lifetime, or at least for a long period of time?
I know. I have been suffering from rheumatoid arthritis from 2009. I can say 2009 until initially it started with dry mouth and things like that. So it took a little bit time for us to find out what the problem was. Then I was put in a tablet called HCQL. So I was having that for quite some time, and the side effects of that was I developed a black pigmentation all over my body. So I need to stop that medicine, and I tried various other medicines like Ayurvedic, homeopathy, etc., and nothing worked. By then, my arthritis had flared up quite a lot, and all of a sudden, I used to stay in Abu Dhabi then. So my doctor used to be Nasreen Mohammed in Abu Dhabi. She was working with the Lifeline Hospital then, and she started with again the prednisolone and other things, and finally with methotrexate. And even that didn't work. I went to the biological medicine, Embril. I was in biological medicine for almost 1.5 years, I can say. Then with the methotrexate injections and other things. Now I am out of all those things, and but now I'm out of injections, but I do have methotrexate 6 tablets a week, and medication is extremely important. Along with the medication, I do lots of yoga, walking, and I have changed my diet also quite a bit. I won't say that I have become 100% gluten-free, but yes, I have become 70% gluten-free. Mm-hmm. And diary also I have stopped to a great extent. Yeah. So that all those things I feel matters a lot, and along with the medication to keep you moving forward, right? Initially, yes, I used to feel really sad when I was in such a situation, because my affected areas were my toes and my hands, fingers. So my ankles were okay. So I used to feel very sad about that. But yeah, once or twice, once I got well, I had, this is years ago, I had stopped with methotrexate. But everything flared up so much that then I understood that I cannot stop the medicine. I have to go with the medicines, only then it works. Along with the diet, exercise, everything matters. It's a package like.
This is an extremely important point, and thank you for bringing this to the surface, because we tend to think that the treatment for arthritis will be there as long as the symptoms are there. While for arthritis, it's very important that patients continue the medication even when they seem to be, under control.
You're all right.
Because of the medication. We can sometimes do some de-escalation. This is something that can be done, but this has to be, done with your doctor, discussing, the treatments with your doctor, and it can be only done with medical, advice. But stopping and discontinuing medication would mostly result in flare-up after a week, 4 weeks, etc., even a month later. And I just wanted to clarify a point, because we are here to talk about medication, and you mentioned hydroxychloroquine and the side effects that you got from hydroxychloroquine. Dr. Atheer, can you tell us briefly about this specific side effect and how frequent is it?
Thanks, Dr. Rita. It is a well-mentioned side effect, but only more side effect to start with. They are not exceeding 2% or 3% in general. We prescribe hydroxychloroquine in a condition lupus much more than in rheumatoid arthritis. We have a really good number of people taking this medicine. The side effect, I've seen it here in Middle East more than when I used to see it in England. And it has been linked more to the slightly, let me say, less white skin color and more Asian population. And when I moved to Middle East, yes, I have 4 or 5 patients, mainly lupus and also 1 or 2 rheumatoid, have this side effect. Obviously, to women, this is an annoying side effect. From the first sight, we can consider stopping it. I have a couple of people have the pigmentation just like disappeared. So it does happen, but most side effects would disappear when stopping medication and change to something else. That's what I can say in it. Usually side effect with hydroxychloroquine in general, they are minimal. It's one of the most tolerated medicine also.
Yeah. And that's actually what makes it a very good drug, a very tolerated drug, and used even during pregnancy and lactation. We talked about biologics, and we mentioned biologics at least twice here. I would like Dr. Kirthi to give us a very brief overview of the side effects, the most significant side effects, because patients fear biologics, and this is the side effect is mainly the main reason why they are always nervous when we want to start a biologic. Dr. Kirthi, what are the most significant side effects?
With regard to the biologics, they form the next level of treatment. Unlike the conventional medicines like methotrexate, hydroxychloroquine or leflunomide, which are usually orally taken, and methotrexate at times before heading for biologics, we go the parenteral way. With regard to biologics, all of them are injectable, and just before the biologics, in between the conventional medicines and biologics, we have oral medications, the small molecules. We have medications like tofacitinib, baricitinib, and apremilast. Tofacitinib and baricitinib is used for rheumatoid, and apremilast is used for psoriatic arthritis. So these are oral molecules, and previously the difficulty with the biologics was about the injectable mode. So the development of these oral molecules has been a big boon, particularly for those people who are quite skeptical about injections, have fear of needles and all. So we have something to transition directly to the injectable ones. But overall, looking at the side effects, it's common to the oral small molecules and the injectable biologics. Common as being infections, and usually upper respiratory infection and urinary infections. These are the common infection, and rarely you can get serious infections. This is more common in those who have other comorbidities or coexisting illnesses, like diabetes, obesity, high blood pressure, or a cardiac ailment like a cardiac failure. Generally, we tend to restrict the use to this population, but at times when the disease is severe, we have to go ahead with that. This is of the common infections. Another infection which needs to be mentioned is about tuberculosis, which generally we try to prevent as much as we can by screening for tuberculosis infection. And this is another challenge which we face, like when we screen them for the biologics, the tuberculosis test comes positive, and then they have to go through the treatment for that to proceed with the biologics. And few of them have had these issues. It depends on the person. Some people take it quite positively, go through that and then proceed with the biologic, and they do well. Some of them, they stop there and they are fine to continue with the same conventional. And then later on, they would go ahead with it. This is one thing. Another thing which is rarely noticed is, in spite of doing the screening, rarely they develop tuberculosis. This is very, very rare. But to minimize that, we could educate them about the symptoms and be watchful for it. And one of the things which I do in my clinic is involve the pulmonologist also, ask them to see the pulmonologist every 6 months, and then later maybe on a yearly basis. This is one thing. Regarding infections, another side effect which has been mentioned, particularly the injectable one, is injection site reaction, a sort of redness, itching or pain at the injection site. This was more common in the earlier ones like the Enbrel, but the newer ones are more sophisticated and all of these are less. Other side effects which have been mentioned are about malignancies. And this is one of the biggest challenge in proceeding with biologics. But if you look at the diseases per se, these are all autoimmune diseases where the lymphocytes are in a state of activity and increase in number. And there is also a mention that if autoimmune diseases are not controlled as well, there is a risk of developing a malignancy. So, and many times the treatment also increases the risk. So we cannot predict that. So best thing would be to decide what best at that point of time and proceed with that. There are other less common side effects as well. Rarely neurological side effects can happen. This is usually screened for, we talk to them, we know about it, and we also review all these symptoms. And the aim of treatment is to control the disease and not to bring about side effects. And that's why we are there to monitor them so that the best is obtained, or what we, they get what we look forward to and not the bad of it.
Thank you so much, Kirthi. I know that we're, there is a lot to be said, and I would like to, you know, to have more time to be able to educate more about medication and all what, you know, you could be questioning and, you know, you would like to know. But because of the sake of time, we'll have to end this session and move to the next session. I would like to sincerely thank the patients who took part in this panel discussion. Thank you so much for being here with us. And I would like to thank Dr. Kirthi and Dr. Atheer for us. We'll move now to the second session on Friday.
Hi, I'm Dr. Bhavna Khan, rheumatologist in Dubai. It gives me a great pleasure to introduce this amazing book, The Wellness Guide to Arthritis, written by Dr. Humaira Badshah. It is simple yet comprehensive. It is scientific and evidence-based. Apart from giving you information on various forms of arthritis, the treatment options, it has very simple illustrations on day-to-day exercises for patients with rheumatic diseases such as rheumatoid arthritis, ankylosing spondylitis, etc. My favorite is on the diet and arthritis. This is one of the common questions asked by all my patients, how they can modify their diet to benefit their arthritis. And this book has it all.
Hi, so here we are again to talk about another disease, psoriatic arthritis, which is one of the main inflammatory arthritis that we see in the clinic. And for that, we have invited a brilliant rheumatologist, my friend, Dr. Nada Mustafa. Dr. Nada Mustafa, who's a consultant rheumatologist in Mediclinic Parkview in Dubai. She's graduated from the Royal College of Physicians in Ireland and in the UK. She's been she's been a consultant rheumatologist since 2011, and she moved to the UAE in 2017. Dr. Nada will be introducing a couple of slides. I mean, she'll be talking about psoriatic arthritis first, and then we'll have the opportunity to hear from two lovely patients who accepted to be with us tonight. Dr. Nada, please, the floor is yours.
Thank you, Ghita, and thank you very much for inviting me to talk in such a prestigious event. And I'm glad that Sabah and Gemma were able to attend. Can you see my slides?
Share your screen, not yet.
Okay.
Share your screen.
Right, let me see. How do I do that? So, hi everybody. Thank you very much, Ghita, for the kind introduction, and thank you for giving me the opportunity to talk in this prestigious meeting. I will talk very briefly in layman terms, as they say, about psoriatic arthritis. And then after that, I will have two amazing patients that I will gonna talk about psoriatic arthritis and their journey through the disease. Just have a few slides to talk about psoriatic arthritis. So I have nothing to disclose. So the psoriatic arthritis is actually a chronic inflammatory condition that affects the joints, causes inflammation in the joints, and particularly this specific type of arthritis inflames the entheses. And entheses means where the joints where the tendons and the ligaments insert into the bone. So you can see this cartoon here. This is what a normal joint here looks like. And you can see here the whole joint here being inflamed, and we call this arthritis or inflammation of the joint. And in this particular type of arthritis, it's the entheses or enthesitis, where the tendons you can see here inserting into the joint where the actual inflammation starts. So this is a particular, uniqueness about psoriatic arthritis because it inflames that. And as you're all aware, this is a condition that happens in patients who have a history or even a family history of psoriasis. And characteristically, the joint becomes swollen, inflamed, obviously, and painful. But even the tendons also can get swollen, inflamed, and painful. And it's a big thing because according to the World Psoriasis Day Consortium, there's 125 million people worldwide suffering from psoriasis. So that represents about 2 to 3% of the population. In some series, up to 10%, in other series, up to 30% of patients who have psoriasis can develop psoriatic arthritis. There has been so many literature about this. There has been, for example, a prospective study performed in Germany where they've just sent questionnaires to patients. Over 1,500 patients were given questionnaires who had history of psoriasis, and they asked them if they had joint pains, and 20% of those actually were diagnosed subsequently with psoriatic arthritis. 85% of these were not previously diagnosed. So I think the scale is a lot larger than what we actually think. So in the majority of cases, the psoriasis itself, which is a skin condition, precedes obviously the inflammation of the joints or the psoriatic arthritis. It usually, like the patient would have psoriasis for say 5 to 10 years, and then later on they develop these arthritis. But actually about 15 to 20% of patients actually get the psoriatic arthritis preceding. So, you know, it's not always the case that the psoriasis precedes, but the norm is the psoriasis and then psoriatic arthritis develops. So it can be insidious, which means it takes its time to develop, you know, like achy joints, and then suddenly it gets worse, or it can be acute. So patients can just have acute onset of pain, and that can happen in about a third of patients. Now, this slide here illustrates the whole gravity of the psoriatic arthritis. So it's not only the joints. As I said to you, the NCCs can get affected. You can get the whole digit inflaming, like this here condition called dactylitis. You can see a picture here where the whole finger swells up like a sausage. That's a very characteristic feature of psoriatic arthritis, and we don't see that a lot in rheumatoid. And you also, as I mentioned before, have inflammation of the incisors. Of course, you have the skin involvement, but you can actually also have back involvement from sacroiliitis and inflammation of the sacroiliac joint of the back. And other joints, obviously, the peripheral joints also can get affected. The incidence is equal between men and women, but men, they have certain characteristics of the disease. So they have more of the back inflammation and stuff, while the women, they have more of the peripheral joints, the small joints of the hands and the feet affected. And the age of onset is between 30 to 70 years of age. But in general, it's equal between both races. So what causes psoriatic arthritis? We still don't know, but we do know that it's an autoimmune problem. So your own immune system is mistakenly attacking your joints, inflaming the joints. And you know, there is definitely genetic element to it, because you will have a family member who has psoriasis or psoriatic arthritis, you know, in about 40% of patients, and sometimes, you know, more than that. And we have also have other risk factors like immunological factors, or even you know, infection has been also postulated. Like, for example, certain cases of pustular psoriasis have happened after repeated streptococcal infections. So there might be a link between maybe a viral trigger or a bacterial trigger. But what we do know, and I've seen quite a bit, and I'm sure a lot of my patients will tell you, that trauma can actually precipitate an onset of psoriatic arthritis. And I'll interview Gemma later on, and she can tell you about that. But also stress. So stress is also one of the triggers for psoriatic arthritis. So you might have psoriasis for a number of years, and then sudden, you know, massive event that happens to your life, or sudden stress that happens to your life, and then you suddenly develop psoriatic arthritis. There's also certain things that can tell us whether or not, you know, like hints that will tell us specific patients with psoriasis will develop psoriatic arthritis. For example, if you have extensive psoriasis in most of your body, this is one thing. Also, if you have extensive scalp involvement, if you have extensive nail involvement, that is, we've also seen more psoriatic arthritis develop in these kind. And sometimes in certain areas, for example, in the perianal region, in the intergluteal region, also we have seen a slightly higher risk in those patients to develop psoriatic arthritis. And there's also close relation with the body mass index. So the bigger you are, you know, the higher risk, you know, with psoriasis to develop psoriatic arthritis. So this is again just a slide to show that there are multiple joints can get affected. So you can have this symmetrical, which looks like rheumatoid in both hands and stuff, but you can have, you know, one single joint affected, or the asymmetrical side, like one side more than the other. Or as I said to you previously, you can have psoriatic arthritis just involving the spine. And this is one of the things which is very important. And that's what we're trying to train our dermatologists to think about. So if you have a patient with psoriasis that comes to you, don't only ask them whether they have joint involvement, if they can see swelling or stiffness. Also ask them if they have back pain, if they have inflammatory back pain, if they wake up in the morning stiff, if they have, so that they can then send the patients to us, because we would like to know about these patients and treat them early. Okay. So as I mentioned before, enthesitis is very, very important. It's where the tendons inflame, and the commonest place that gets inflamed is in the Achilles tendon, where the Achilles tendon inserts into the bone, this particular area here. You can get inflammation there, or in the plantar fascia. And obviously, sometimes psoriasis is not that obvious. So, and I remember as a medical student, when they used to give me patients to examine with inflamed joints, they would tell me, have you examined the patient, doctor? And, you know, I would miss seeing a little patch of psoriasis behind the ear, or a little patch of psoriasis in the umbilical region. So you can have a small little patch of psoriasis, which you think is insignificant, but actually have psoriatic arthritis, and that's what can give the diagnosis. Right. Also, nail involvement is very important with psoriasis, and it can be as small little nail pitting, like in this picture. Sometimes it's not even as obvious as that, a few nail pits sometimes. That's why we are trained as rheumatologists to look at nails properly. But, you know, but you can have that, or you can have even extensive, you know, nail involvement, like, you know, where the nail separates from the nail. But so you can have psoriasis affecting the nails only without affecting the skin. So it has to be examined as part of the general rheumatology examination. The other two things that I want to talk about is the other associations, although rare, but can happen, which is the association with inflammation of the eyes, which is called, you know, acute anterior uveitis. So, you know, you have to let the patients know that to watch out for any redness or any blurring of vision or any signs of their eyes, because, you know, uveitis can happen as part of psoriatic arthritis, despite it being rare. Or inflammation of the bowels. So we always ask the patients, do you have any, you know, inflammation in your bowels? You know, do you have any, are you passing lots of stools, blood, you know, things like that, because inflammatory bowel disease can be an associated feature with psoriatic arthritis. And the other thing we need to look at also is other comorbidities. So because in general, any type of inflammatory arthritis, particularly psoriatic arthritis, has a higher risk affecting the heart. So we do lead to, you know, like causing ischemic heart disease and heart, you know, problems. So we do need to look at other comorbidities. So obesity, metabolic syndromes, diabetes, blood pressure issues, fatty liver, high cholesterol. So all of these risk factors, you know, need to be looked at as part of comorbidities with psoriatic arthritis.
Remember, I just need to tell you that we are left with 10 minutes, and we
almost 3 more slides.
And we need to, the 10 minutes to, and we would like to hear your patients.
Fair enough. Okay, I'll just keep a few slides. You do know that there is also fatigue, limited function, sleep disturbances, and I won't begin to tell you how, you know, psoriasis and psoriatic arthritis will affect your work capacity and, you know, social, participation and stuff. It is a little bit difficult for us to make a diagnosis because we don't have a blood test that tells us this is psoriatic arthritis. But we look at the clinical picture, we examine joints, and then we make a diagnosis based on that. Blood tests can help us, so we can see high inflammation levels in the blood, and that can help us. X-rays can help us, but we don't actually want to reach a point where we have to see damage on X-ray. So we like to do a lot of ultrasound scan, and you can see some, one there behind Dr. Ghita. She helps me out looking for inflammation and confirming the diagnosis for me. Right, these are just other mimics that you have to make a diagnosis to make sure that it's not something else, okay? And the aim of our treatment for psoriatic arthritis is mainly really to slow the disease progression, relieve symptoms, preserve function, protect joints, and improve the quality of life. That's the aim, okay? We need to do a lot of education to our patients. There are so many leaflets now that are coming out to help talk about psoriatic arthritis and how we manage them. And I tend to distribute these leaflets to my patients. And obviously we have to have like a multidisciplinary approach to the treatment, because I don't want to say, oh, I'm just going to treat my joints and I'll leave the dermatologist to treat their skin. That's not the right way of doing things. And also, if you have someone who has, eye involvement or inflammatory bowels, we need to sit together. We want to come up with one drug that hopefully helps everything. Okay, right. I won't dwell into physiotherapy, diet. People have already spoken about that in the last couple of days, and I really thoroughly enjoyed it. But physical therapy, occupational therapy, very, very important. Non-drug therapy, very important. And these are the drugs that we have. We've been talking over and over again about disease-modifying drugs, about different types of biologics, about targeting molecules that can cause inflammation. And there's so many that we have. We are now, thank God, spoiled of choices, because we didn't have that 10 years ago, 20 years ago. So I think that's me coming to an end, and I would really, really like to talk to both of my patients through just to talk about their experiences with psoriatic arthritis. So Gemma and Saba are both there. Yes?
Yes.
Saba.
Hello.
Oh, Gemma, hi, how are you? Now I can see you. I didn't see you before. Right. So Gemma, I think if I leave this slide on, I think you would be the best to talk about. So I will start with Gemma, and Gemma, please take us through your journey, please.
So I was diagnosed nearly 7 years ago with psoriatic arthritis. So I was 33 when I was diagnosed, and I had had psoriasis since I was 10 years old. However, mine was diagnosed, I had hit my foot and my toe had swollen up, and we had a few months of trying to figure out what it was. I saw an orthopedic surgeon, and then in December, I was referred to Dr. Amel Ganawi, who diagnosed me on the very first day. I started on methotrexate, and I was on methotrexate for about a year, and then the arthritis was starting to flare, so I was started on Humira, and I had great results at the start with Humira. But I needed to have a dental surgery for dental implants, and I came off Humira to do the surgery, and unfortunately my body rejected the dental implants. I ended up with an abscess. I had a massive flare, and it was 4 years ago. It was very hard to control. We had to go on lots of steroids. When I went back onto Humira, it didn't work at all. So it started a long journey with Dr. Amel of what we would try next. So I had then, in my journey, I've now been on Humira, Cosentyx, Cimzia, Enbrel, Stelara, Xeljanz, and I've been on Tremfya now for, it will be 2 years in February. Tremfya is working very well for me now, and I use it in conjunction with sulfasalazine. I've also been on methotrexate, cyclosporin, leflunomide. So sulfasalazine works really well for me just now. About 2 years ago, my psoriasis got out of control as well. My mum was diagnosed with cancer. It was terminal cancer. It was a very traumatic time, flying back and forth. My skin and my joints both reacted. And so between Dr. Amel, my rheumatologist, and Dr. Victoria, my dermatologist, they worked together. I mean, I think I was seeing one of them roughly every 2 weeks to try and get it under control. They were in talks with each other. They were in talks with me. And although I have tried 4 different DMARDs, 7 biologics, and it's been 7 years, I've done occupational therapy, I've done physiotherapy. You have to just keep hoping that there is the right biologic medicine for you. Each time you go, you have to listen to your doctor. I have a very good relationship with Dr. Amel and Dr. Victoria. When I don't feel right, I message Dr. Amel, she fits me in, we try a medicine, we see how it works. If it doesn't work, we have the conversation. But you need to have this conversation with your doctor. I trust my doctor 100%, what's best for me. And I was actually saying yesterday to my husband, it's World Arthritis Day, and I said, I've actually never felt as good as I feel right now. My arthritis is under control. Yes, I take Tremfya monthly, and I get it administered in the hospital because the arthritis in my wrists and fingers makes it a bit difficult for me. I take the sulfasalazine 4 times a day, but I can actually be someone who I wasn't in my 20s and my 30s. And the biologics, they can be a bit, okay, what it is, but try not to Google. Once you Google something, you get too much information. It's never the positive sides. If you do have concerns, talk to your doctors. I mean, when my daughter was 5 when she was diagnosed, so she's always grown up with mum not being very active or in pain, and she said now that it's so nice to see me being the type of mum that I've not been able to be before. So just don't give up hope. There is the right biologic. I've tried 7. Some have worked, some have done nothing. One did absolutely nothing. I was like, am I broken? But there is another one to try, and there's new drugs coming out all the time. But don't try and change your doctor. Stick with your doctor. It's not your doctor's fault if a medicine doesn't work. I've tried 7, but it wasn't Dr. Amel's fault. This Tremfya works amazingly with sulfasalazine, but we don't know what's going to work. You've just got to have hope.
Absolutely. That's amazing. Amazing. Thank you so much for such an inspiring, exactly what I wanted to tell the audience. So amazing. Thank you so much, Gemma. I also want to interview Sabah, because Sabah, she had the most traumatic, I met Sabah about 2.5 years ago, and it was very sudden onset, and she was, she's a very young lady, and she was crippled, literally. I haven't seen inflammation as bad as that. I would like her to talk a little bit about that, Sabah, and I just want her to tell me how you changed your life, Sabah, because I was very, very happy, to see Sabah change her life with this. So she made a positive, input from this psoriatic arthritis rather than negative. Her life has completely changed. Sabah?
Hello, my name is Saba. Thank you, Dr. Nada, for introducing me. Well, like Dr. Nada said, I was diagnosed with psoriatic arthritis about 2.5 years ago. I've had psoriasis for about 10 years, and it was all over my skin, and I went to dermatologists. I never knew it could lead to psoriatic arthritis. That was something I was not aware about. And then I had I'm a mom. I've got now blessed with 3 children. So with the 3rd pregnancy, and it was a very hard, complicated, high-risk pregnancy that I had. And it was a very traumatic. For me, it was very stressful, and there were chances of maybe the baby having some serious health issues when it was born. To deal with that, I think 6 months after my daughter Sophia was born, the pain started coming. My psoriasis was flaring up. It was all over my body, and then it started with plantar fasciitis. I'm not sure how to pronounce these things, but it just got worse and worse. And because you're a mom, and you just think, oh, it's the lack of sleep, and I'm just tired. You just try and brush off these pains, and you just try to be a superwoman. And that's, I think, the wrong thing to do. When your body's telling you something, you need to listen to it. The pain got so bad, and that I realized the problem when I was struggling to hold my 5-month-old baby and feeding her or changing her nappy. And I wasn't, and I had 2 other little young boys as well to look after. It was very hard. I went to Dr. Nada. She immediately diagnosed me very accurately, started me off on methotrexate, and luckily my insurance covered biologics, and I got onto Panera, which worked instantly. So unlike Dr. Nada's previous patient, Gemma, for me, the medication, I was struck gold, and Dr. Nada prescribed me the right thing, and it worked for us. So that was a good thing. But what I'm here to talk about mainly is, is different. It's about it's about mental health issues which I face, you know, and a lot of it is probably not discussed. Nobody's aware about how the depression that affects you and the seriousness of it. I was plunged into such serious depression about even like, you know, it was the most extreme form of depression where I was like, is it even worth? I felt quite useless and, you know, very low self-esteem. It felt like it was a burden. Let's just put it that way. That's what it does. I don't think that, you know, sometimes it's very hard because it's like an invisible illness. You can't see it, but only I am feeling it. And I know what it is. So it's hard for the family to understand what you're going through, or it's hard even for you to explain because you don't want to make a big deal out of it and you still want to carry on. So that was what it was. So it's like a vicious circle because depression increases inflammation, inflammation increases the arthritis then goes back to the depression, and it's like a vicious circle. We're just stuck in this circle. How do we get out? So it's the triggers, you've got to find the triggers. It's the stress, you know, and over time you will know what is causing the arthritis to flare up. And I can easily identify it was work. If it's work, unfortunately, and if you know it's causing it, you're going to have to make that hard decision to quit the job. And I know it's the most hardest decision because you've worked all your life and you studied for a profession, and then you have to make that decision. But try and think of it as a break. Or listen to your body. So there are a lot of things that you have to understand, like sometimes you got to make the hard decisions, but it's for your own well-being and your family, and then you end up having a more productive life. I think quitting at that time when I had to, it was so scary. I didn't think I could ever do it. And I thought, this is it, this is my identity. I'm a working mom. That's all I have in my, you know, what else am I? But it has been, and I've actually found other, hobbies in the end. I never thought, I never had the chance to go to the beach or enjoy just swimming in the sea or paddle boarding. You know, this is something new. I've done it after arthritis, and I would never have thought, I mean, pre-arthritis, I never did any of these things. I never went to the gym pre-arthritis. And now I'm a proper gym bunny, and I'm always going to the gym. I did not even know how to use any of the machines, but now I do. So what I'm trying to say is that, you know, sometimes even a hard-hitting disease like this, which you could think of it, oh my goodness, what's happened? And it's caused such depression. You can turn it around and make it a positive thing, and you get to experience more than what you didn't.
Absolutely. And I see that change in you, Sabah, every time you came to the clinic, you know, because Sabah has got a severe form of hypermobility, by the way, as well. And the treatment is physio and toning your muscles. And actually, it was the first time we actually got around treating her hypermobility as well. So, you know, I'm very proud of you. And Gemma, I'm really proud of how you trusted us and trusted Amal, and I think you guys are amazing, and a true inspiration to all of the other patients, basically.
Oh, thank you.
Thank you, Doctor. Thank you so much, Dr. Nada, for your presentation, and thank you so much to your patients for being here. I hope that this has been as liberating for you as it was inspiring for us, because we're very inspired by your stories. Thank you so much. Thank you. We'll move now to another disease, another complex disease, which is lupus, in a few minutes.
I was very happy to read the book published by Dr. Humaira Badsha, The Wellness Guide to Arthritis. I am a patient and was diagnosed with rheumatoid arthritis over 10 years ago. And I was very pleased because the book is not limited to just scientific or the traditional Western medicine approach to arthritis. Of course, it talks about the science and the different types of arthritis and the importance of having proper diagnosis and proper protocol for managing the condition, including medication and assistance by your physician. But the book goes well beyond. It's actually a holistic integrative approach to the patient.
Hi, good evening again. And now we're shifting to another disease, another challenging disease, which is lupus. And to discuss about lupus, we have invited two brilliant rheumatologists who are colleagues of mine, Dr. Beena Hameed and Dr. Shazia. So, how can we? I don't see the bios. Yeah, so Dr. Beena and Dr. Shazia. Dr. Shazia is a UK-trained rheumatologist working at Sheikh Khalifa Medical City in Abu Dhabi. She's a consultant rheumatologist with a long experience in rheumatology. She's a member of the British Society of Rheumatology and holds a fellowship with the Royal College of Physicians. She's an excellent international speaker, and she's interested in research, and she's published a couple of papers in peer-reviewed journals. Dr. Beena Hameed is a consultant rheumatologist and internist, accredited and certified from the Joint Royal College Training Board in the UK. She's currently working at King's College Hospital in Dubai. Floor is yours. I will give Dr. Shazia now the opportunity to start talking about lupus. Dr. Shazia, floor is yours.
Thank you, Dr. Ghita, and good evening, everyone, and a very warm welcome to this session, which is going to be on lupus. So it's mainly a patient-driven session. I'm going to talk a little bit about lupus, but mainly the talk is going to be by our two two panel members, which are patients with lupus who would share their experiences and their journey of lupus with you. So as Dr. Ghita has said, I'm Dr. Shazia. I have Dr. Beena with me, who's a consultant rheumatologist, and I have two patients who have suffered from this disease. I've got Henna Asprey and Miss Elvira Khan. As you know, lupus is a chronic autoimmune disease. It's a disorder of the immune system where some of the cells of the immune system become quite active. They start producing extra proteins in the body, which we call autoantibodies. And these autoantibodies can cause a lot of inflammation. And if this inflammation is not treated, then it can start affecting different organ systems of the body. For example, it can start affecting the joints, the skin, and the mucous membranes. And sometimes it can go on to affect the heart, the kidney, and the brain. So it's very important to diagnose this condition when patients have it. And often we see that patients often get diagnosed late, and there are many reasons behind it. And one of the major reasons is that patients, as well as physicians, often don't think about it. And if you think about the symptoms, they're also at the beginning quite non-specific, and then they can be put down to many other conditions. For example, patients present with rashes on their face, a feeling of tiredness, fatigue, pains in their joints, and these are very non-specific symptoms. They can often be put down to many other conditions. The tests that are used to diagnose lupus are not part of routine testing. So if you're not thinking about it, you wouldn't test for this condition. So it's very important to be aware of this condition, and we are very fortunate nowadays that we have a lot of targeted treatment, and patients, if they are treated regularly, they see their rheumatologists regularly, and they have periodic checks, they can have a normal life, and they're able to do everything that they want to do in their life. So in order to talk about this further, I'm going to now start talking to one of our patients. So this is Miss Henna. So she has suffered from lupus for a number of years. And I would like to now start talking. And Henna, so thank you very much for joining in the session.
Thank you.
So would you like to tell us a little bit about your condition? What symptoms did you have when you were diagnosed with lupus?
Yeah, sure. So it took, like you said, a little bit of a while to get to the diagnosis of lupus. I was diagnosed in 2017, just after the birth of my daughter, with Hashimoto's thyroiditis, and then it all sort of went from there. But the main symptoms that led to the lupus diagnosis were, as you said, chronic fatigue. And I'm a mum. My daughter was very young, and I knew this wasn't just tiredness. You can tell the difference if you've had a terrible night's sleep or a few terrible nights' sleep, and then this bone dead tiredness. So full fatigue. Anytime I had sort of a cold or was a little bit run down or stress, I had the rash, the butterfly rash, very painful, very stiff joints, hair loss, ulcers all inside my nose, and yeah, just really susceptible to colds and flu. And then when I did get them, they would hang around for weeks or months. And then, sort of insomnia and those sorts of things as well.
So at that time, did you actually think about lupus, or when you went to see your doctor, did he think that you had lupus?
No, it took 4 different doctors to diagnose lupus. To start with, my endocrinologist, who diagnosed the Hashimoto's, suggested that I see a rheumatologist to start with, because I'd mentioned about this fatigue, and he'd noticed the sore fingers, and because Hashimoto's is, an autoimmune disease, he wanted me to see a rheumatologist as well. And the first rheumatologist I saw diagnosed me with RA, rheumatoid arthritis, and put me on hydroxychloroquine, and it really didn't do anything. And so I thought maybe I'm just, maybe I'm just a stiff person, or maybe it's age. And so it took a little while, but then in 2018, I started feeling very unwell, and all my face started swelling up. And I was diagnosed with mumps. But I had mumps when I was a child, and I didn't have a fever. I didn't have any of the other symptoms of mumps. And so I saw a different doctor, and it turned out that I was then diagnosed with Sjogren's syndrome. And so it was my glands swelling and then atrophying that were causing the mump type symptoms. And then after that, I was diagnosed with that in the UK. And then after I saw that doctor, that was the first time I'd heard of lupus. And he actually said, you couldn't possibly have lupus because you're young and you're white, so you can't have lupus. And so then I thought, okay, it's a bit strange. So then I came back to Dubai because I was in the UK just for a few months, and then started having these terrible headaches, the awful rash all the time. And the headaches were so bad that I had to go to the emergency room. And that's when I was referred to Dr. Nada. And quite quickly, Dr. Nada diagnosed me with lupus and also antiphospholipid syndrome, which is what was causing those specific headaches at that time. But over the course of my treatment with Dr. Nada, she'd also diagnosed some other things that were making my lupus symptoms worse. So she ordered an MRI and a CT scan to check what was going on in my head with these headaches. And she diagnosed something, or found accidentally, something called Arnold-Chiari malformation, which is where your skull's the wrong shape for your brain, essentially, which was causing these or exacerbating these headaches. So we had to have the surgery for that to remove a piece of my skull to give my brain a bit more space, which then helped with the headaches a little bit. So then we could properly work on fixing the lupus symptoms after that.
So it looks like it was quite a few years in which you were diagnosed with different autoimmune diseases, but not really lupus. So yeah, the diagnosis of lupus came quite late. Yeah. And the other point, it's a very good point that you made, that you had headaches, and it could have easily been put it down to lupus, but then it was later found out that you had another diagnosis as well. So so not everything is due to lupus. Okay, so so in all these years that you were suffering with all these symptoms, how did it affect your family life or your work life?
In lots of quite unpleasant ways, actually, because with lupus, you only have a very sort of limited supply of energy. And so you really have to pick and choose what you can do. And, it's quite difficult to come to the realization that you can't do everything that you want to do. So yeah, I was that really unreliable friend who would call the day of the meeting and say, I'm really sorry, I'm too tired, I can't come. And that's, it's just not a nice thing to have to do. And I've got a young child. When I'm flaring, I can't pick her up. I can't run about outside with her. I'm very, very sensitive to UV, which here is a particularly difficult one. So it means that, I can go to the beach with her for half an hour or an hour, and then the next day I can't get out of bed. And when my lupus is in flare, it's very, very bad. But when it's managed, the difference is crazy. Like I feel like a different person when my lupus is under control.
Yeah. So did it go on to affect any organs of your body? So for example, did you had any inflammation in the heart or in the kidneys?
It started on the kidneys, but we caught it sort of at the right time and then managed. It was all just serendipitous timing. So we found the right medication at the right time.
Right.
And yeah, so much better now.
Yeah, that's good to know. So would you like to take us through your medication journey? Because I know that you've tried a number of medication, and so would you like to tell us about that?
Yeah, sure. So it's similar to Gemma in the last session. We just started from the very beginning. So with hydroxychloroquine and anti-inflammatories and those sorts of steroids. And then we've tried azathioprine, Imuran. We've tried methotrexate, we've tried leflunomide, we've tried a few different other things. We've tried blood thinners to help with their headaches. Lots of different sort of supplements, but as well, because I'm on thyroxine as well, you have to be careful about the way that they interact and those sorts of things too. And about 8 months ago now, we started on belimumab. How do you say it? Belimumab.
Yes.
Injections. So they're the subcutaneous injections that I do myself once a week, and that's made just a world of difference, and that's what works for me. So that's what we're sticking with now. So I'm on the belimumab with hydroxychloroquine, levothyroxine, obviously, and then a few different supplements because I'm, pretty much always anemic. I've always got vitamin D deficiency because I can't go outside in the sun and those sorts of things. But we've come to the right cocktail now, I think.
Yeah, so it looks like you found the right biologic as well for yourself, just like our other patient Gemma did. But you had to go through all the other medication journey before this. Yes, okay. So regarding the medication that you took, so why were they stopped? Were you getting any side effects, or were there problems on the blood test?
Yeah, so some of them just didn't work. The same as Gemma, felt no difference at all. We had to stop on methotrexate because it gave me really bad gastric inflammation. Terrible. The azathioprine, Imuran, gave me verrucas, terrible verrucas on the bottoms of my feet, which took years to manage with a dermatologist. And so, it was just working through it and, giving, it was very frustrating because, you've got to take them for a certain amount of time to be able to rule them out. But just sticking with it was definitely worth it to make sure that I got to the right one.
Yeah. I think this is the problem with many of the drugs that we're using in rheumatology, that they are slow acting drugs, and the patient has to just bear with us sometimes, because often they take 2 to 3 months to work. And often, sometimes we start patient on a low dose and then we work the doses up slowly as the patient can tolerate. But I'm glad to know that you found the right drug. So just one more question before we move on to our next patient. So now that you said you're very well controlled on these belimumab injections, have you ever thought about stopping the medication?
Well, I didn't want to, but over the summer, I contracted COVID, even though I was fully vaccinated. So obviously I had to stop the Benlysta, the belimumab, because of it being a biologic, you have to stop it. And after maybe a week of not being on it, I just went into full flare. So full flare, as well as COVID, being stranded, because I was on holiday in the UK when I caught it. So stranded in the UK. Stress was insane, and so I would never recommend just coming off it ever. Back on it now. I'm on injection 6 after starting back on it, and it's just about starting to calm back down now. As you can see, my face is just starting to calm back down. I can wiggle all my fingers. So it's getting there. It's getting there.
I think that's I think that's a very important message that you gave, that although you may be feeling very good and you'll be tempted to stop your medication, but you shouldn't stop, stick to the meds. Yeah. Okay, so I'll hand the floor over to Dr. Beena now, and she will be talking to you, and as well as our other patient, Mr. Beena.
Okay, very good evening, and thank you. It's Alvira Khan, right? I'll be talking.
Yes.
And thank you for joining us this evening.
Yes, thank you. Thank you so much.
Excellent. So as I was told to give a brief overview of the medication that I use in lupus, I'm going to say very briefly about them, as Dr. Shazia has already talked about the lupus symptoms and the difficulty sometimes diagnosis. So similarly, the medications that we use in lupus, they're blind therapies. We don't know which patient, which medicine will work. So many a times you might be given one medicine and that might not be for you, you want to other. So that is a journey. I'm sure you would tell us about it. So generally speaking, there are medicines like disease-modifying therapies, like many other people have spoken this evening about even other conditions. So these medicines, they're called slow-acting because they take time to build up their effect. So essentially, that's the time when we ask our patients to be patient. It would happen, but you got to give it a good chance, a fair chance, and don't be disappointed with it. But then there are other medicines, such as anti-inflammatories, such as steroids, which work quickly, but we don't want them to be for a long period of time because they do have side effects long-term. So certainly they are sort of bridging therapies. They help us to control the disease while we're waiting for the disease-modifying therapies to work. Yes, they do have side effects, but then we monitor them very closely. So I think instead of going into details of one by one, I would ask you to, first of all, very briefly, if you could tell us about how was you diagnosed with your lupus and what difficulties you had to go through, both physically and psychologically. And then certainly we'll talk about more about your medications.
Yes, thank you so much, Dr. Beena, to hand it over to me. So I would like to start my journey. First of all, I was diagnosed this in back like 2013, sorry, 8 years back. I was firstly diagnosed with cortical venous thrombosis in my brain, which was, there was a clot formed. And after that, after 6 months, the clot was dissolved. I was treated. I was here in Al-Zahra Hospital. I got admitted there, and then 2 weeks I was there, and then I flew to India, and then I started my treatment in India. So until 2016, when I met Dr. Kirthi Raju, I was treating myself in India only. I used to visit India every single year and treat myself there with a physician in Goa. And then right after 1 year, 2013, I was diagnosed with cortical venous thrombosis. Right after 1 year, I was diagnosed with this SLE, which is systematic lupus erythematosus. And there the treatment started. I was on Salcept, I was on HCQS, which is like mycophenolate and HCQS. And then I started with steroids too, which was, I started with steroids. I was injected steroids like every year. And then in between conditions came, there was flare-ups, like I got SLE related headache. Again, I was admitted in the hospital 2015. And again, I was injected with steroids. And then again in 2016, I became better in 2015. And then again in 2016, I was admitted in the hospital due to pancreatitis. I got pancreatitis. And then there again, I developed again one more condition called avascular necrosis in the hip due to high dose of steroid. And after that, 17, 18, 19, it was better. I wasn't, there wasn't any major condition. And but in 2020, there was a major condition. All my flare-ups, it got increased. And then I was again injected the steroids, high dose of steroids. And that affect, first my right leg was affected. Now my left leg is also getting a little bit affected. The necrosis is a little bit increasing in my left leg also. So this is my condition. And last year, in the end of 2020, I got a condition called ulceration of vulva, which made my leg more stiff. So it was because of the infection which increased because due to lupus. So there increased an ulceration of vulva, and that was there for about nearly 2 months. So it made my leg more stiff. So yeah, that's it. I have only this much to tell. This is my history. And now I'm on Benelista. So I'm hoping that Benelista might cut down my steroids so that I can live a better life. And I think also that mind also, like in this 1 month, I don't know why, but my mindset has changed. I feel the disease more, like I have to cure the disease more through my diet, through my, I have to be more active. I have to be more happy. I feel if you be more happy, there's this cells, I don't know, the inner cells, which comes up and say, yeah, you are happy. So the disease won't affect you. I mean, it's like more of your mindset. You should make a mindset that, yes, you need to fight with the disease. Yeah, there is disease, but then you don't have to take it. And I was very depressed. I used to be very depressed. I used to be always like, oh, I can't do this, I can't do that. I'm now 22. I'm just so helpless. I have to tell always my parents, bring this, bring that. And it was feeling like I'm so, I can't just do it. I'm just useless. I don't have a point to stay. So there was a point, like I was always used to be depressed, but now it's been a month. I'm happy. I don't know why, but I'm happy that yes, I mean, always I try to be happy. I don't let the depression come back. I don't let the loneliness come back. I'm just trying to be happy now. Yeah, that's it. That is all about me.
Very good. I'm very pleased that in a very brief way, you described all your illness and your journey. And I must say, you're a very brave girl. And I think sure the other listeners would benefit from your journey as well, that you have gone through a lot, but still, despite that, you're a positive person, which is excellent. I think this is a very good message to send to other patients and other people who are listening, that being positive and trying to help yourself is one of the best way to treat your conditions, right? And of course, seeing your doctors, listening to them, and following up with the medications and the treatment you've been given is the way out. And you did very well. And I would say, I see that unfortunately you had one of the complications from steroid use, which we do see time to time. Unfortunately, doctors have to give steroids when the disease is very bad. And this is one of the side effects. But again, there are other things that we can do and help people with even to overcome the side effects. So can I ask you another question? And yes, you're young, but then obviously you must be planning to have family at some point.
Yes.
Have you spoken to that to your doctor about it?
Yes, I have spoken to Dr. Kirthi Raju regarding my pregnancy, if I can in future be pregnant or not. But she told that yes, there are people who become pregnant if you have the immunity, if you have that strength to become pregnant, and if you have the will, obviously you can do it. So yeah, I was a little bit like firm with her this advice. So I am not worried now. Right now, I'm trying to treat myself. I know that if not in future, if I'm not treated completely, if I don't have this normal life, still I'm willing to take up the family. I'm having the will that I can do it.
Excellent. That's very positive of you. And actually, the good news is that, yes, lupus is not something like previously people used to say, oh, you have lupus, so you cannot have children, you cannot have family. This is not true. Yes. And there are treatments that are quite safe, and even during pregnancy, and you can safely get pregnant and have a baby. All you have to do is to plan it in advance. You have to talk to your doctor, and one needs to be sure that the disease is very well controlled. and the medications which are safe in pregnancy, that's you're taking rather than those which are unsafe in pregnancy. So essentially, if you talk to your doctor well in advance, 3 to 6 months beforehand, your doctor would change the medication to those who are pregnancy friendly medicines. And then with the help of a good obstetrician, regular visits to your doctor and the obstetrician, this is very much possible nowadays. So yeah, it's a very good positive thought about you. Just one more question. In terms of physical functions, you said you have avascular necrosis, which is affecting you now. What physical problems are you having, or you had it in the past?
Until last year, when I didn't have the ulceration of vulva, my leg was a little bit flexible. I could move, I could walk. I had this flexible movement, a little bit of. But then when I got this ulceration of vulva, I was just complete bed rest. I couldn't move my leg. There was not even a single movement of my leg. So I think because of that, there was a more pain during the October, November, December until Jan. My pain was just keeping on increasing. I couldn't walk properly. I just don't used to wake up from the bed. It was problem for me to go to the washroom. I used to be like, why I should go to the washroom? I mean, why? And that ulceration was also very bad to an extent, which was again stressing me out. I was just completely gone. I couldn't do what should I do and everything. But luckily, she told me to visit a dermatologist. I treated her, and then she did the bandage and all of that sort. And then now it's healed. Now I can walk properly. And I'm like, that was just like a bad dream, which just came into me, and then it's just gone now. So only that part affected me. Rest, actually now I can move my leg, but yes, as the other patient, my other friend said, that when there's a steroid in you, you are completely a different person. I can just relate to what she's feeling. I'm just a completely different person. Like I'm normal. I can just sing, dance, do whatever I want. I can do anything in life. It's like that. But then when there is pain and when there is some condition in you due to inflammation, then you are just utterly a different person. You just want bed. You don't want anyone else. You are just into your pains. And I have pain, I have this, I have that, I can't do anything. It's just that. So just
both Hannah and yourself, you're absolutely right. In lupus, there would be at times that you might feel very low and you won't have much energy to do things. Best thing is then to take it easy, right? And just wait for the good time, good days. And being positive is the answer, as Alvira, you said. If you're a positive person, you can pull through it, right? So this is one of the messages. And then, this is life. Even if you don't have any conditions, we have times we are not very happy. We have times we're very happy. So this is kind of life. So, and I'm sure when we try and adapt ourselves to the situation we are in, we can easily pull through, right? So I think we can conclude here that, and I think both of you have been excellent speakers, and I really enjoyed the way you have gone through bravely your condition, and you told us about the difficulties you had day-to-day life and with your medications. And I think we can now conclude here.
Now we have one more patient with us.
Okay, all right. I don't know if we have more patients. Okay, fine. Who else?
Can we just get her perspective and probably a brief overview of her journey?
Good, excellent. I think it's Josna here, right?
Hi, Josna here.
Oh,
yeah.
Hi, Josna. Good evening. Thanks for coming.
Hi.
Right. Okay, we can't see you, Josna.
I prefer to switch off the camera.
Okay, so would you like to tell us about your condition, about your lupus journey? Would you like to share your experience with us then?
Yeah, sure. with regard to my condition, I was diagnosed 7 years before. And however, I didn't know what exactly it was my condition. So my condition started with the joint pains and stiffness and with no movements in my shoulders. So I had to visit a physical physician, general physician, and then from there he had recommended to go to rheumatologist. From there I got to know about the rheumatologist. Before that I never heard about it, and we didn't know there is something called rheumatology or RA. So after that, I visited many rheumatologists. Initially, I visited some of the rheumatologists where they gave me hydrochloroquine or medicine. I'm not very good in telling the medications because I have gone through with the many medications as well. So all the medication didn't work very well for me. Later on, with several blood tests and going through with many doctors, I got to know that I have an overlap syndrome where I have RA and lupus both. So it was very difficult for my doctor also to give me prescribe me medication which suits for RA and lupus both together. So it was, I had been to in many medications, like all the patients have already said, like Alvira and Hannah, they already told same medications I have been through, where some of the medications gave me literally a very bad condition, allergies, though I have taken it before, but when I took it in the second time, I had literally allergy on full of my body, and I had to get admitted in the hospital to recover them. And very often I used to go to emergencies due to my pains all over my body and joints. Also, my lupus was kind of skin related, and I used to get those butterfly rashes on my legs, and it used to be very, uncomfortable because I couldn't wear the dresses where I wanted to wear, and I couldn't go anywhere else, or to work or to family functions. So these are the conditions that I have gone through. Apart from that, the disease itself is make you feel, fatigue or stressful. In family as well, it is not very well known what exactly rheumatology or lupus it is. So making them aware about this was also big task in a family. And of course, later on, everybody understood and supported. So we could come across our depression, and it took some time for me to recover from my lupus, but now I'm doing pretty well. As I think Alvira said, she's just started with the Benlysta, but I had already done for 1 year now. And also I had taken steroids before, which I stopped and then started Benlysta recently, 1 year ago, and I'm doing very well now. So this was my journey about this, and I don't know if you have any other questions related to this.
No,
sorry. Yeah.
So,
yes, I was just going to say, Josh, it looks like your journey was pretty similar to the other two patients, that it took a while before the doctors found out that you had lupus, and you were diagnosed with other autoimmune rheumatology conditions before they could say that you had lupus, and then you had to go through many medication before they found the right medication for you. But it seems that that things have turned right for you. So all this is a very interesting session, but we have to conclude in the sake of time. So I would like all three patients one by one, if you could like to give one tip for the audience, a closing remark, a take-home message, that would help all the patients who are listening. So I think maybe Hannah, we will start with you. Hannah, are you still with us? It looks like we don't have Hannah, so maybe Alvira, you can give us a message, and then Josna, you can give us a message.
Yes. I can give you this message that always try to be happy. You should find small things like happiness in every small thing. Just stay away from like toxic people, toxic things, toxic everything. Just whatever gives you negative vibes, just don't take that. Just try to set your mind that no, positive. Just bring positiveness in your mind and just be happy. Just try to do what you like, eat what you like, but in a limit. Control your diet too. But whatever you're willing to do, try to do that. Just be happy. That's it. I have just this thing to do, because this disease is like dis-ease. It gives you dis-ease. To make it ease, you have to do what you like. So I feel just happiness. Be with people who you like, not with people who you don't like. So just be happy. I just wanted to say be happy.
Very sweet message. Yeah, very sweet message. Yeah,
that's it.
Very sweet message. Yeah. So, Josna, would you like to give a message in the end for our audience?
Because Alvira already said that we need to be positive and happy. So in addition to that, I would definitely say to do a consistent follow-up with the doctors, not to skip them, and take the medications regularly, and to put some reminders, and whatever possible way that you can take the medication to remind yourself, because this is very important. Because if we skip the medication or the follow-ups with the doctor, it is very difficult to control the disease itself. So and be positive and talk to yourself that you will be fine one day, and you can do anything, whatever you want. So this would my advice one day.
Thank you.
Thank you so much. Thank you. I would like to thank Dr. Shazia and Dr. Beena for moderating this session, and for being for their insights during this session. And I would like to extend a big thank you to those to all the patients who inspire us and keep inspiring us every day. Listening to you today was extremely touching. On a personal level, I would say that we grow up, we learn, and we get to grow also with you. Thank you. Thank you for being, and I know we're late tonight. Thanks for staying and bearing with us. And the World Arthritis Week continues tomorrow with Arabic sessions and Urdu sessions. So be there. Thank you.
Thank you.
Hi, my name is Devyani, and I have dealt with autoimmune disorders for over a decade now. The Wellness Guide to Arthritis by Dr. Humaira Badshah is not a book on just arthritis, but on a multitude of other autoimmune disorders. And what is really fantastic about this book is that she also details out recipes and a holistic way of actually dealing with these autoimmune disorders. This was a book I wish I had had when I was unwell, because it would have helped treat me faster and better, because information otherwise is only available in silos, and it all comes together in this book. So if you or your family member has an autoimmune disorder, I would highly recommend that you get your hands on this book. It will just make your life a lot simpler in providing you knowledge and ways to fix it and deal with it. Thank you.
Hello, this is Dr. Humaira Badshah, consultant rheumatologist, board member, and founder of the Middle East Arthritis Foundation. It gives me great pleasure to invite you to World Arthritis Week from the 10th to 15th of October. It's a completely online event. Come and learn from expert rheumatologists, physiotherapists, yoga specialists, and nutritionists about your arthritis.
Hi, I'm Sandria. On behalf of the Middle East Arthritis Foundation, I would like to invite you to register to the World Arthritis Week, which happens from the 10th of October. A lot of doctor-patient discussions, professional speaking on mental and emotional well-being, yoga and Pilates and dance happening. So please go all out, register yourselves, friends and caregivers, and enjoy yourselves.
مرحبا أنا عبير. أنا كتير متحمسة وأنا عم بستنى الإصدار الجديد من أسبوع مرض التهاب المفاصل العالمي اللي حيكون أونلاين حيبدأ ب 10 أكتوبر. جلسات ممتعة ومعلومات قيمة ومفيدة بانتظاركم، لهيك لا تنسوا تسجلوا حالكم وتسجلوا عائلاتكم وأصحابكم. بنشوفكم بجلسات الأونلاين، ديروا بالكم على حالكم.